Thank you, Chairman Searcy, Republican Chair Ortatai, and committee members. My name is JB Branch. I'm an artificial intelligence policy expert at Public Citizen. We're a national nonprofit with more than 1 million members and supporters nationwide, working to defend democracy, resist corruption, and challenge corporate greed. I'm going to take a note from Chairman Searcy and skip over some of these notes and just focus on some of the main points here. I speak with a lot of legislatures across the country, and I actually just last week testified before the Congressional House Committee on Financial Services on artificial intelligence. AI is a big deal. It's going to continue to be a big deal. It's a focus not just in this legislature, but within Congress and states across the country. There was some talk earlier with regards to federal regulations, and right now there are no real federal regulations on AI. That's why advocates like myself have had to lean on and really look at state leaders to lead the way. It might be no surprise to anyone here, but Congress simply doesn't have their act together when it comes to this topic. Polls show pretty consistently that Americans want some form of regulation on AI. And there have been multiple attempts to try to preempt state AI regulations multiple times over. And the polling, again, consistently shows across the United States, regardless of political ideology, that people want protections, consumer protections when it comes to AI. I think in large part that is because Americans have a lot of buyer's remorse from listening to social media companies in the late 90s, early 2000s, when they basically said, don't worry about it, we're the experts, just let us regulate ourselves. And what we're seeing as a result is rampant misinformation, algorithms that harm children, young girls being pushed towards anorexia, other kids being pushed towards suicide because we allowed these tech companies to regulate themselves. And so, state legislatures have to be the adults in the room if other folks aren't going to step up. This bill in particular touches on a variety of issues that Public Citizen is really high on, and it's very important to consumers. One being transparency. It requires disclosures for folks to realize that they're interacting with AI. That's huge because more and more, as we see, folks are having difficulty determining whether or not something is AI or not. It's easy when you call CVS and you're screaming on the phone because you're saying, just get me to a pharmacist, I don't need this loop. That's easy, but it's gonna become increasingly harder to determine what is or is not AI. And part of that is because a lot of companies view this as a means to basically cut a lot of jobs. The next push in AI is going to be agentic AI or AI agents. And this is sort of the dream for a lot of these companies where we can just start automating tasks left and right, and these agents are going to be able to take care of those tasks. There's a huge assumption in that, and there's a huge assumption, particularly with a lot of folks who are really high on AI, buy into the AI hype. And the one assumption that I'd like to just sort of flag is this assumption that AI, artificial intelligence systems, will just have a true north and continue focusing on that true north and continue to get better. What they don't flag is a concept referred to as AI drift. And what AI drift is, essentially, you may have heard of these instances in which these algorithms result in discriminatory outcomes, or most famously, there's been several teens who've harmed themselves by suicide because these AI systems encouraged them to do that, and there was no human in the loop, like my colleague said, to intervene. Some people might ask, well, why would you allow a product out there into the ecosystem that is going to allow something like that to happen? there may or may not be guardrails on some of these things, but what ultimately ends up happening is that these AI systems are focused on what I refer to as their goals. And they try to get to their goals as efficiently, as quickly as possible. And that's where you see this AI drift that occurs. And so one of my concerns with these AI agents is that almost assuredly, if they're working from a corporate background, their goal is going to be maximizing profits. And the concern with that is going to be, if they're not concerned about the healthcare consumer, if they're not concerned about the consumer that's right before them. And with enough data over time, they start to drift away from what we would consider core consumer rights values and start to drift away into this sort of like AI slop where consumers start to get harmed. We're seeing that pretty consistently across the board. Particularly when it comes to AI in healthcare, there have been a variety of studies that have shown, it's not infallible. And that's why we do need humans in the loop. That's why we do need people to intervene when things go wrong. There's no industry that requires empathy more, I would argue, than the healthcare industry. I mean, there's research that even shows like just a hug as a patient can actually improve health outcomes. And so to strip that empathy away, the potential patient advocate from that system, I think is just harmful in general. But there's a variety of studies that have shown that, some of these AI systems replicate some of the bias in their data. That includes bias that results in misdiagnoses, unequal treatment for women, unequal treatment for Black patients, individuals with disabilities, and as well as individuals in rural communities. I'm from Lebanon, Pennsylvania. I grew up there. I'm a graduate of Cedar Crest High School. When I was growing up, we didn't have that many healthcare facilities around. And what's going to be sort of the talking point for a variety of healthcare industries is going to be, well, these AI systems are going to provide those folks that care. But I can assure you that what those communities need is they need real doctors. They need real nurses in their communities. They don't need that outsourced out to a robot. Additionally, this bill also includes provisions that touch on accountability measures, ensuring that any sort of decision is going to be reviewed by a medical professional. That's going to be increasingly important moving forward. There's provisions that speak to responsible data. In this age of AI that we're moving towards, data is the key. Data is the power, whether that data is clean, whether that data is sloppy, and where that data exists. I worked with a school district in California, and they had an AI chatbot that had its servers overseas. That is a huge no-no. And so we need to know where this data is going to be incorporated at, where the servers are based in, because it's both a patient privacy issue, but it's also a national security issue, again, in this age of AI where data is incredibly important. Finally, just to wrap up, I think this is a very thoughtful bill. It's forward-looking. It's going to place Pennsylvania as a leader amongst a variety of states. There aren't that many states that have AI healthcare bills. So by pursuing this bill and moving it forward, the Commonwealth of Pennsylvania will automatically sort of be shot up as a leader in this area. It protects patients, enhances care, but most importantly, it's grounded in values, fairness, safety, and accountability, and respect for the people that we hope to serve.